Anyway, so it has reached, at least it has demonstrated a reduction in heart failure hospitalization in patients with the type 2 DM. So this benefit occur by the existence of cardiovascular disease. So let us look at the details of the analysis. So this is the outcomes stratified by the presence or absence of established cardiovascular disease in this group of patients. So on the left, you can see that for patients with or without established cardiovascular disease, there was a reduction in hospitalization for heart failure compared with placebo. So how about in patients with previous heart failure? So does the presence or absence of previous heart failure affect the benefit of this drug? As you can see, even in patients without prior heart failure, the dapagliflozin is associated with a reduction in heart failure and hospitalization. So let us look at the secondary endpoint. So for the secondary endpoint, the most interesting endpoint is the renal composite endpoint. In this study, we can see that dapagliflozin actually can slow renal disease progression in patients with type 2 DM with relatively good baseline renal function. You can see that dapagliflozin is associated with a hazard ratio of 0.76 compared with placebo in terms of the development of renal complications. So the next question, similarly, does this benefit affected by the presence of pre-existing renal disease? So this is another post-hoc analysis. On the left, you can see that if we stratify them according to their renal function, it seems that patients with good renal function to start off with benefits the most from dapagliflozin. Whereas in patients with borderline renal function, yes, still there seems to be benefits, but it does not reach statistical significance. But mind you, this is a post-hoc analysis and it may be affected by sample size. And also on the right, whether this is the benefit is affected by the pre-existing cardiovascular disease. You can see that in patients with either pre-existing cardiovascular disease or multiple cardiovascular risk factors, they benefit in terms of reduction in composite renal endpoint. The second secondary endpoint is more all-cause mortality. So unfortunately, dapagliflozin has not been shown to reduce all-cause mortality in this study. So to study a drug, it is important for you to know the risks and the benefits of the drugs. So we have so far discussed about the potential benefits of the drug. So how about the risk? So this is the safety profile of the drugs. You can see that for dapagliflozin, numerically, it has not increased the risk of amputations or fractures, as well as the development of malignancy. There may be a slight increase in volumes, depletion, and also genital infection, as well as DKA.